Welcome back to West New York Living. Anytime any of us hears the word cancer or surgery, it's bound to cause a great deal of anxiety. Fortunately, for everyone, advances in medical procedures are taking a bit of the fear out of both of those words. I recently stopped by Winsong Interventional and Vascular Services to find out more about two outpatient procedures they are performing. One to stabilize vertebral compression fractures and the other to help those with cancer tumors. The procedures are truly life-changing. Most adults and seniors are probably familiar with the word osteoporosis. It's a thinning and weakening of bones, most of the time associated with aging. This medical issue oftentimes leads to fractures in the hips, wrist, ankle, and even spine. Needless to say, the quality of life for those affected by osteoporosis can be greatly diminished. But the kyphoplasty and ablation procedures performed by Dr. Dana Dunleavy and the other doctors and staff at Winsong Interventional and Vascular Services are drastically changing the lives of their patients.
Not everyone realizes that a hip fracture or a vertebral compression fracture actually have a very high mortality. So the morbidity, the complications associated with it, such as pneumonia or clots, disability such as not eating well or lying in bed, those are very high with these weight-bearing bones like hips and spine. And if you delay intervention, basically you have a cascade of bad things that happen.
For vertebral compression fractures of the spine, one potential treatment option is kyphoplasty, which is a minimally invasive outpatient procedure being performed inside Winsong's state-of-the-art surgical room. With precision, Dr. Dunleavy places a small jack inside the spine, after which cement flows in to stabilize the fracture. It's what he calls cement containment. We mentioned that this procedure helps those people suffering from osteoporosis, but Dr. Dunleavy also mentioned that this procedure, along with ablation procedures they're performing at Winsong, can change the quality of life for those who have bone cancer tumors.
Most important factor to patients is quality of life. And if you can intervene on these fractures, which don't happen just because of osteoporosis, so weak bone or disorganized bone just from aging or health, but the fact that the tumor can actually destroy the bone and cause it to collapse. In those cases, we're able to do a very similar process of stabilizing the spine, improving the alignment of the spine, but also killing the tumor at the same time. And we've had improvements in the technology so that that treatment doesn't take so long. And that's been a big holdup in the past, is just the procedure took a long time, which could be difficult for the patient. One of our goals is to prevent it from going into the spinal canal and compressing the spinal cord or the nerves that go down to your legs. And so while we're there, we basically turn on these probes that heat the tumor and kill it. And we work very collaboratively with the other doctors, the medical oncologist, the primary physician, the radiation oncologist, because even if you're going to go through radiation, you can imagine going through 8 weeks of treatment can be much better tolerated after you've taken that pain away and improved your alignment in the spine. And then, I think that one thing to discuss is this technology exists in other places of the body, despite, the fact that it's done for tumors in the spine, which are actually extremely common. It also works the same technology for lung tumors or kidney tumors or liver tumors. You're using these things like microwave ablation and radiofrequency ablation and cryoablation, all different energy sources to basically kill the tumor where it is. And one of the things that's really remarkable about that is if it's a painful tumor, it takes that pain away rapidly, as opposed to some of the other treatments which take weeks and months. And so the technology is all related. And so if you can be an expert in minimally invasive tumor ablation, you get good at all of those different types.
For Robert Quick, his options to treat his lung cancer were very limited. After a serious bout with COVID-19, traditional surgeries were out of the question. But the lung tumor ablation procedure performed by Dr. Dunleavy not only helped with the tumor, but most importantly, Robert's quality of life.
I had no concept of this new procedure and these new technologies. And this ablation procedure was just beyond my wildest dreams of it being so pain-free and brief and efficient. And so I was very grateful that my oncologist knew of Dr. Dunleavy's good work and got me in touch with him.
One of the things that's really helped improve awareness not only for patients but for treating doctors is adding some of these additional treatment options into NCCN guidelines. And once we put tumor ablation in, it really improved the conversation for the oncologist and the radiation oncologist to say, okay, which of these options is best for the patient, or sometimes it's more than one. And the process makes it very easy both for the patient and their supporting family.
Now, the kyphoplasty procedure and lung tumor ablation procedure are just a few of the life-changing, minimally invasive treatments being performed by Dr. Dunleavy and the medical team at Winsong Interventional Vascular Services. To find out more, head over to the website at winsonginterventional.com or give them a call at 929-9484.